A dental crown or cap is a tooth-shaped cover that is placed over a weakened or damaged tooth to protect it from further fracturing or deteriorating. When a tooth is cracked or has a large defective filling, it is often best to protect it by placing a crown. This is especially true when there is a crack around a large, older filling because it can easily break. Over time, if you have a large or older filling, the forces of biting and chewing can cause a portion of the tooth to break off and require a crown. It is important to evaluate cracks as soon as possible because they can grow quickly. If they reach the nerve, root canal therapy may be required. If the crack extends to the root, the tooth may need to be extracted. A crown may also be needed to protect a tooth after a root canal, replace a discolored tooth, replace an older defective crown, or to simply improve cosmetics. At your first visit, the area is numbed to make you comfortable. Your dentist will use a dental handpiece to shape and prepare the tooth so that the crown can properly fit over it. Next, impressions are taken of the prepared tooth. Oftentimes, a temporary crown is placed to protect a tooth while the final crown is being made. The impressions are used to fabricate a model of your mouth on which the final crown is made. Your final crown may be all metal, all ceramic, or a combination of both. Because all crowns are custom made for you, it may take more than one appointment to complete. When your final crown is ready, dental cement is placed into the crown and it is cemented to the prepared tooth. The tooth is now restored to a healthy and functioning state. Your doctor will check your bite with articulating paper and make adjustments as necessary. Don't be alarmed if you need your crown adjusted more than one time to customize the crown to your unique biting movement. Please keep in mind that the longevity of the crown depends on many factors, including your diet, the health of your supporting tooth and gums, regular checkups, and your oral hygiene habits. Remember, it is important to maintain your crown and all of your teeth with proper brushing and flossing.